Hello and welcome. You're watching India Fights Back with me, Rajat Kain. Well, in the wake of rising numbers of COVID positive cases across the country, Prime Minister Narendra Modi held a virtual meeting with the chief ministers of the states to chalk out strategy of way ahead. The former focused on doctrine of testing, tracing and treating without getting too intimidated with the rising numbers. So how critical is the situation and what is the game plan of centre and the state and how they plan to control this surge? To discuss further on this issue, we joined with panel of two guests. Shashank Joshi, member COVID-19 Task Force, joins us from Maharashtra. So many thanks for joining us, Mr. Joshi. And Dr. Lakshmanan, Mission Director, NHM Assam. Many thanks, Dr. Lakshmanan, for joining us. Let me start with you, Mr. Joshi. Sir, given your state continues to be among the highest contributors of positive cases in the total numbers, what is a game plan now which is adopted by Maharashtra in terms to address this second surge, which is of course increasing with each day? Like yesterday we had 1.2 odd cases, 1.2 lakh cases, and now like we are clocking about 1,30,000. Sir.
Rajat ji, you are very right. The situation in Maharashtra is grim. But, this week and next week probably we'll be able to dent the surge.
Okay.
We have upscaled in the last 4 weeks the testing, as our Honorable Prime Minister has said, which was happening around 30-40,000 per day. It has almost gone up to 1.8 to 2 lakh tests per day. The tracking also we have enhanced for the last 6 weeks, which was very lapse and has gone up to 1:30, 1:40. And the final thing is we want to have early treatment. The good thing is that the recovery rate is almost 80-90%. Most people are asymptomatic and the case fatality rate is low. The challenging part is because the sheer numbers are like a tsunami, the healthcare system is getting overwhelmed, predominantly because these are less exposed people from a better socioeconomic strata or from rural India. And because they are hit hard, there has been a sudden upsurge of cases. The healthcare infrastructure, bed availability has come under a lot of threat and challenges. And of course, we are doing genomic testing to find out whether there is a variant which is responsible. But currently, the standard management strategies remain the same, which is test, trace, and treat. And we are reasonably certain that our fight is on. We don't want to have any fatigue setting in, but we still seek citizens' cooperation to test early at the first symptom rather than doing a CT scan, taking home-based treatment. We would encourage them to come out, openly test, and get immediate attention to the healthcare authorities and get themselves treated. Because remember, more than 80-90% of COVID is completely manageable at home. Right. And a few which the hospitalization also, most of them recover and do very well.
Certainly. So clearly, contribution from the citizens is also required so as to address the surge. And that is something which experts have been saying so as to follow COVID appropriate behavior. Dr. Lakshmanan, Mission Director from NHM Assam. Sir, what situation in your state, given it's a state which is also busy with activities like election campaigning? So what is, the numbers showing in Assam?
India is witnessing an extremely alarming rate of upsurge of cases. But at the same time, the response from the country has also been really good. As rightly mentioned by Joshi sir, the idea is to test maximum number of people. When we compare the two surges, let us say this is the second wave. In that case, the first wave, we had a gradual increase of cases, or the perception was that it was a gradual increase. But at present, suddenly in 1 month's time, the number of cases have become almost 5 times. Of course, there is a huge increase in the case, but at the same time, the factor that earlier our testing facilities were limited, we were able to test a finite number of people earlier, but at this point of time, after 1 year of emergence of COVID, our testing facilities are also much more enhanced. We are able to do rapid antigen as well as RT-PCR test. Of course, the onus, the significance of RT-PCR test is very, very great, but still we have multiple testing facilities which have resulted in huge number of tests and therefore huge number of identification of positive cases as well. Right. Therefore, what we are witnessing is we are getting a very sharp increase in the number of cases, Had our testing facilities been best, we would have had a gradual increase in the number of cases. Second point, as rightly told by Sir, the point is that the more quickly we identify a positive case, the more efficient we are in reducing the spread. It is not a point to get panicked just because we are having 1 lakh plus case. It is also a point of hope that we are able to restrict this 1 lakh people from spreading the disease. And
Right.
yes, the health personnel are fatigued because of doing this activity for more than a year now, continuously every day in and out. But at the same time, initially last year, when we were admitting every person, keeping them for 10 days or maybe more in same hospital, we have come a long way that now we are confident to allow maybe 80-90 percentage people to undergo their treatment following home isolation. Maybe 10-15 percentage people needs hospital admission now, and even many of them may not require 10 days hospital admission or hospital inpatient treatment. Many of them may be allowed to go back to home isolation after continuously monitoring them for 4, 5, or 6 days, so that they are now stable. They can complete their treatment with home isolation. So many things have improved, but none of them take away the risk that if we don't control the disease, even with the better facilities, better understanding, there might be a situation when the enormous number of cases, serious cases, will put a burden upon the available health facilities. So
Right.
that is why we have to immediately control the number of cases through a very, very, very active testing policy.
Well, that's really important. And yeah, please, sir, please go ahead. You're completing. Yeah, please, please.
And the second part of your question, that is, what is the current status in Assam?
Yeah, yeah, yeah.
See, very similar to the other states. The number of cases in Assam has almost increased 4 or 5 times. But obviously, the difference is that our baseline is very small. Earlier, we used to have 30 to 40 cases per day. Now we have about 190 to 250 cases per day. This is
Okay.
almost 4 or 5 times the number of cases. But since our base was very low, 250 cases per day is what we are getting now. This is definitely an increase, but again, not a position to be panicked yet.
Right, Dr. Lakshmanan, that's really important. Even though the baseline of the number of positive cases from Assam happens to be fairly low if we compare to other states, yet the state is taking all the precautions and all the steps. That's what needed. Well, I mean, Prime Minister, while having a virtual meeting with Chief Ministers, stressed on the need to create micro-containment zones to effectively contain the rising cases of COVID-19. So, Mr. Joshi, how important is it, therefore, to have, or rather first identify and then, just work upon these micro-containment zones? How many such zones have been identified in Maharashtra? Why I'm asking, because as both of us acknowledge that Maharashtra is one state where numbers are fairly high.
In Maharashtra, unfortunately, there is community spread of the infection, and therefore containing and micro-containing has become a challenge. But in geographic clusters like Akola, Amravati, Vidarbha, Marathwada, where the pandemic started for the second surge around a month back, we were able to clearly identify and delineate those micro-containment and containment zones.
Okay.
Even today in cities like Mumbai, Pune, Nashik, Aurangabad, Nagpur, we have in each of these geographies, in each ward, at least 8 to 10 containment zones. So, this is very crucial because there is a large pool of invisible, suspect and positive asymptomatic cases. As Dr. Lakshmanan rightly said, we need to catch what the Prime Minister emphasized yesterday. They need to be contained. If there is a building with a floor of with 5 people which are positive, that floor needs to be sealed, that building needs to be sealed, and we need to ensure that it doesn't spread and test other people who are there. So if you are able to do that efficiently and effectively, most people now we know to manage them home better and do a proper quarantine so that it doesn't spread and affect the day-to-day livelihood of other people. So a lot of restrictions are in place, but in Maharashtra, unfortunately, the overwhelming test positivity rate in certain geographies, in major urban clusters and some rural clusters is pretty high. and therefore a lot of restrictive measures have gone, and we are still focusing on better contact tracing and better micro containment, because this is the only way we can handle the pandemic better. And the optimistic side, as I said, is excellent recovery rate and a very low case fatality rate. At the same time, people should not forget the timetable of COVID. COVID is a 2 week disease. And sometimes what happens that they are absolutely asymptomatic in the first week. And in the second week, they get something called as hypoxia. So as long as they have a pulse oximeter at home, they do a 6-minute walk test and they don't desaturate, we are good. But if they desaturate, they should be digitally connected. We have very good apps now. eSanjeevani is there. The Arogya Setu app is there. You can use any of these apps to get connected digitally to any doctor in any part of India and get yourself managed better. So that if you can handle yourself at home and know the red flag, if your doctor tells you, then you can go to a corona care facility or a healthcare facility for treatment. It's very important to recognize that. And it's very important to appropriately, treat early, because most COVID is manageable and treatable. If we go to hospital, if they need oxygen or if they need some steroids, they can be administered the same if they get into hypoxia situation. So complacency should not be there and they should not go very late. That is another challenge which we are facing now. And Maharashtra has been acutely hit in some geographies, which is why some more restrictive measures have been put in some cities and some geographies.
Mr. Joshi, Maharashtra was one state which started enforcing lockdown, or to say restrictions in certain districts, in certain towns, well before we got these figures of 1 lakh plus. So how has those restrictions or those mini lockdowns in districts and towns have helped in terms of arresting the rise of numbers in those areas?
In many of those districts and geographies, now the pandemic will start plateauing down. The rate of rise of numbers has started coming down. And in another week or 2 weeks, we will see a plateau effect coming up. And obviously, we will all wish whatever goes up comes down. All waves which go up will always come down and recede. And we wish and pray that in the next 2 to 4 weeks, Maharashtra and major geographies of Maharashtra will be out of this pandemic. But remember, COVID is always going to stay. The mistake which we made is that we need to ensure that tell people in the local language they understand that COVID appropriate behavior is mandatory. It's important that they mask. It is important that they don't unmask. When they have to eat, they eat on their own. They ensure that they double mask. They use the properly fitting mask, which is completely covering right above their nose and below their chin, and not let their mask slip down. So it's important that they appropriately mask and they sanitize, they keep some distance, because that is still going to remain throughout 2021 and 2022. Whether you vaccinate, whether you get COVID, whether you don't get COVID, COVID appropriate behavior is mandatory. And we need to avoid crowds, we need to avoid poorly ventilated spaces. And that's exactly what our Honorable Prime Minister said, that do not forget COVID appropriate behavior. And I think it is a time to cooperate for states, center, people and officials, all of us to work together to handle this pandemic better.
Right, absolutely. Dr. Lakshmanan, we just heard from Mr. Joshi as to how those restrictions and those mini lockdowns in certain districts and towns have helped in at least having, some sort of a control over numbers. And he's hopeful that in a week or two, this wave, at least as far as his state is concerned, will definitely start showing a downward trend. So, Dr. Lakshmanan, there's a question, like, hypothetically speaking, will your state opt for restrictions on the containment zones or areas if the numbers start showing up on the higher side? I know at this stage it's fairly low if we compare to other states, and it's a good thing. I'm sure your colleagues have done a good job, but what if numbers start rising in the state, given, as I said, this is a busy time in terms of, the elections are there, a lot of campaigning is going around. So what is the game plan in vis-a-vis that?
Coming to this question, yesterday when Honorable Prime Minister Sir was interacting with all the Honorable Chief Ministers, this point was pretty well upon. The general understanding that a large-scale lockdown will actually affect a lot of normal people, affecting their economic activities, their regular activities, their jobs, and the services which they provide. One better way would be to isolate and restrict the movement of those COVID positive people and their immediate surroundings.
Mm-hmm.
That exactly is the scientific principle behind micro containment zones.
Mm.
Rather than closing all the people, better identify and isolate those people and people surrounding them. So this is a slightly more tedious, more microscopic, more specific action. This is a tedious work, but to be honest, this is more effective and also helpful to the society. That is why micro containment zone has been promoted in a very scientific manner.
Mm-hmm.
Now, the practical application of this, as far as the state of Assam is concerned, as on date, all the three phases of election have been completed. Most of the uh, people are now looking forward for the festive season, which
Right.
includes Bihu, Ramadan, Ramnavami, all these activities. And many of the schools will be going for summer vacations, and few schools will be having pre-examination holidays as class 10 and class 12 examinations are also coming up in the next 1 or 2 months. So the situation now is to understand exactly where the cases are happening and how to contain those specific areas. Because by containing them, we are actually saving the larger area from going for lockdown. At the same time, the micro-contained areas prevent spread of disease from those locations to other locations.
Hmm.
But yes, the state is carefully considering weighing in all the options, and we are trying our best to ensure that with limited disturbance of the general activities, we would be undertaking micro containment zones wherever required, as this is the best way to protect the greater interest of the society.
Right. So micro containment zone is a best strategy so as to say in terms of restriction, as all the states and center is at complete consensus that this is not the time for a complete shutdown or a lockdown as we saw last year. Certainly there are some areas which needs to be stressed upon where you need to follow strategy of testing, tracing, treatment, COVID appropriate behavior and vaccination. Mr. Joshi, we spoke about the containment zones and strategy of testing, tracing, and treatment. Now, when it comes to vaccination, what has been a response so far of public in terms of vaccination in your state? I mean, are you still having a lot of people who are still coming to, rather waiting for vaccination? How smoothly is the entire process going in your state?
So, Rajat ji and Dr. Lakshman ji, our state initially was very slow. The takeoff was very slow in the first month, particularly with the healthcare workers. And even now, only 40-45% of healthcare workers have got vaccinated. Even the frontline workers, they were a little slow. But later on, in the month of March, I think after the Honorable Prime Minister took the vaccine, and also our Honorable Chief Minister took the vaccine, there has been an exponential rise. And that rise has been remarkable. And we are overwhelmed with the response. Most of the centers run full now. And Maharashtra has been, I think, the leader in the country in vaccination now. And I think we see the younger population coming out faster. But my humble appeal to every citizen of India is first protect our senior citizens. It is very crucial to save lives in COVID. And
Right.
that is why we must follow the mandate given by Government of India of protecting the most vulnerable first. So people above 45 need it the most. Because they need it the most, we must ensure that them, the healthcare workers and the frontline workers are vaccinated at the earliest. And we must try to get to that to almost 80, 90 or 100%. And that is now, as I said, Maharashtra has taken out. Also what happened with the surge coming up, a lot of people also got sensitized that they need to get vaccinated. Now remember, vaccine will see its effect only after a month and a half. And even after 1 or 2 doses, you may still get the infection but may not get severe disease or death. So whatever vaccine you get, don't have hesitancy. Any vaccine is okay. Both are homemade vaccines. Both are safe. Both are approved by our Honorable Drug Control Journal of India after going through scrutiny and testing. And both the vaccines can be administered safely if you are eligible. So my suggestion and humble appeal to everyone who's listening is if you are eligible, get vaccinated so that we can protect ourselves and protect others. But after vaccination, don't develop any pseudo confidence. Ensure that you still stay protected. Keep your masking on for this whole year. It doesn't mean that you have vaccine means now you can unmask and do what you like. You very much still need to stay protected. particularly in that 2 months, because right now we are at the peak of the second surge, and the vaccine will really help us to dent if there is going to be a so-called third surge. So that is where vaccine will help. And I think we must congratulate for building a digital platform now. And in that digital platform, things have become very easy and transparent so that people can go. This is the largest vaccination program on planet Earth.
Yeah.
India has been leading the world in smallpox, in polio. WHO has acknowledged our contributions. We have been in part of the vaccine diplomacy. We are the vaccine pharmacy of the world. Half of the world's vaccines are made in India. So we should be very proud of our vaccination program, and we should enhance it further so that we optimize the vulnerable groups as early as possible.
Right, right. Many thanks, Dr. Shashank Joshi, for giving us or bringing to us to light the steps taken by the administration in Maharashtra, and of course, like in terms of not just testing, tracing, treating, and COVID-appropriate behavior or enforcing COVID-appropriate behavior, but also the response of vaccination. Many thanks, Dr. Lakshmanan, for joining us from Assam, and of course, bringing to us as to what state is doing so as to maintain its good track record. Let's fingers crossed, your baseline happens to be still on the lower side, and we hope that very soon even it gets further lower. Well, that's it in this edition of the show, but before we leave, a small appeal to all our viewers. Please maintain COVID-appropriate behavior, keep wearing a face mask, keep washing your hands, and do not forget to maintain social distancing. Remember, these are small things that can help us in defeating this pandemic. Well, that's it in this edition of India Fights Back. Thank you. Goodbye.